joining us now, I'm very excited, Dr. Molly Rutherford. And I tell you what, we're excited to have Dr. Rutherford on because last week we had a doctor on who was really concerned about the fact that doctors would be employees of hospitals under Medicaid for All. They would all work for the hospitals, and many of them are now, and they get a paycheck from the hospital. So they're basically an executive with a hospital, but they're a doctor, but they're an executive. So it's kind of, it's, okay, where's that come from? And we were talking last week about, well, doctors from hospitals, they're getting a paycheck from the big hospitals. So is their first loyalty to their patient? Is it to their employer that's paying them, right? So we said, okay, let's get a big time doctor on that services people, her patients every day, that works for a big hospital, and how would this whole thing work? And I tell you what, the best health plan put out, though, is by the Job Creators Network and Elaine Parker Foundation president, who developed healthcareforyou.com, healthcareforyou.com. The White House has picked it up. They've got Republicans in Congress picking it up. Guess what? This thing done by Job Creators Network from the ground up, guess what? It is going to be the signature healthcare bill that Republicans run on and the president in 2020. And guess who did this? Job Creators Network. It's unbelievable what they've done. Republicans couldn't do it. Paul Ryan couldn't do it. All the bureaucrats couldn't do it because they went top down. Here is what Job Creators Network did. They went bottom up. They talked to doctors all over the country. They talked to rural hospital executives. But here's what else they did. They talked to patients, single patients, married patients. They talked to people that wanted health care that were aged, young, millennials, to be millennials, not millennials, older people, middle age, kids in college, out of college. They talked to them all. That's how they developed their plan. Grassroots, very exciting. Joining us now, that's a kind of a long introduction, isn't it, Dr. Molly Rutherford? Dr. Rutherford, thanks for being with us.
Thanks for having me. Can you hear me?
Have I outlined everything pretty accurately?
Yes, absolutely. So,
okay.
Yep. Do you want me to just talk about my practice?
Yeah, you know what? Last week we had a sole practitioner on, and she was saying, the problem with Medicaid for All is that all the doctors are going to work for hospitals, right? And then they are responsible to their boss, the hospital, not to their patients. You work for a hospital. You're paid by the hospital. Explain this phenomenon. Okay, explain this for us.
I don't. So I do not work for a hospital. I did. I am a primary care physician, board certified in family medicine and addiction medicine. And my first 5 years out of residency, I was employed by a hospital system. And then 3 years after that, I was employed by an independent practice, but that was referred to as a patient-centered medical home. So it was very bureaucratic. It was very entrenched in third-party billing. And then I learned about a practice model called direct primary care in 2014 and decided to start my own practice. So I know how both situations work. I now own my own practice, and I do not bill insurance or government for my services. So I'm able to offer affordable services. I'm able to be more accessible. People can call and do a visit over the phone if they want to. Part of the problem with the traditional practice model where doctors are employed by a hospital system, and I think it's about 53% of physicians are employed and not in independent practice. And in primary care, it's even higher. I think 70% of the American Academy of Family Practice or family physicians membership are now employed by hospital systems. So the problem is you don't get paid unless you have some sort of billing code that is sent to an insurance company or to Medicare or Medicaid. And so even if somebody called, for example, and said, I'm not sure if I need to be seen, I think I just have a cold, they're going to be told by the front desk, well, you need to make an appointment, just because nobody gets reimbursed for telling the patient, oh, no, you have a cold, you can just do this or that. So direct primary care is great because we can be more flexible and more innovative, And it fits perfectly with the Healthcare for You platform because it truly restores the doctor-patient relationship. We have more time to spend with people, and it allows the patient the control over their healthcare spending. And, I can tell you all kinds of stories of how I have saved people money by seeing me, and how I've saved them money by steering them towards a freestanding radiology facility, for example, instead of going to a hospital-based radiology facility for a test. I've saved people hundreds of dollars and sometimes even over $1,000 just by knowing where people can, where the free market is really working in healthcare.
So, Dr. Rutherford, let me get this straight. So, you started working for a hospital, and now, if I just want to be sure I understand this correctly, now you have a practice that does not take traditional insurance. So you basically pay cash.
Yes.
Okay. So you have a cash-based business. So here is the question, Dr. Rutherford. So what is the difference in cost savings that you have in providing your care to your patients in paying cash with no paperwork, no codes, no, you go in doctor's office, they got three people there in a separate office with 8 computers running all the insurance docs, right? So you have none of that. You come in, you give a check, or you give your Visa card, you pay for your care. How has that brought your costs down? What's the cost savings?
The overhead for running a direct primary care practice is significantly less. It's probably less than a third of the overhead involved with being an independent physician and billing insurance. In fact, that is why so many hospital systems are buying up primary care practices. And they're buying up primary care practices mainly not because they make money on the primary care practices, but because once they buy up the doctor's practice, so say you're in a small town and the doctor has owned his independent practice for years, and this is basically what happened when I was employed by the hospital system in Carrollton, Kentucky. The physician I was working with had owned his practice for 20, 30 years, and he did fine until the healthcare system just became so bureaucratic and the third parties gained all the power. And then his overhead was so much and the administrative tasks were so burdensome that he was needing to see a patient every 10 minutes in order to meet overhead. And then this is just what's happening with physicians all over the country. They get overwhelmed with the administrative burden involved, and then they give in and the hospital and lets the hospital buy their practice, and then they no longer have the power. So as an independent physician doing direct care, I don't have any of that overhead involved in billing or coding. I have 2 medical assistants. I rent space. And then the other thing that most people don't know is because even the lab that I work with doesn't have to bill insurance for lab studies. We have an arrangement called client bill. So the lab that I use comes in, or we send our specimens to them, but instead of them billing insurance for, say, a complete blood count, which if it's billed to insurance can be over $100, they bill me $3.50 for that test. And so then I bill the patient $3.50 for that test. And so that's, what is that, like over a 95% savings on one lab test. And so we see that for many of the services we provide as well. The way direct primary care works most of the time is we charge a monthly amount, and it covers any services, any primary care services. So say you're a patient, you think you have a mole that needs to be removed. If you go to a traditional practice, you go in, you get an appointment. Maybe they say they can see you in a month.
Right.
You can't even get in quickly. But so by the time you get in, it's kind of a rushed visit, and then they say, oh, yeah, that needs to be removed. And sometimes they won't even remove it that day. They'll say, okay, you need to come back.
In a month.
So then you need to, so then you come back in another month. And, hopefully this thing is not a cancer because you don't want to ignore that.
Right.
And then, so they remove the mole, they send it for biopsy, they stitch it up. All said and done, hopefully you have good insurance because it's probably going to be over $500 for that procedure. Mm-hmm. So if in my model, if my patient, who I know well because I don't have to have as many patients and I am able to spend time with them when they come in, we have a relationship. So they call and say, I have this mole I want you to see. I can say, send me a picture of it. And then if I look at it and I say, oh yeah, I definitely want to take a piece of that. I want to do a biopsy. So they come in and they've already paid for this, all of this, because they pay me $50 a month between the ages of 18 to 45 and $75 a month between the ages of 46 and 65. And then over the age of 65, they pay me $100 a month. So they've already paid for this. It comes out automatically, kind of like Netflix. And then they come in and I do the biopsy. I don't charge for any of that procedure, which usually is charged. If I put in stitches, I don't charge for any of that. I may charge for the numbing medicine, which is, a couple dollars. And then I have an arrangement with a dermatopathologist who will read that biopsy for $40. So I bill the patient $40. So does that make sense?
So basically, when you take all the insurance, all the copay, all the bureaucrats, all the coding, all the Medicare and Medicaid, you take all that out, you just take cash, right? And part of the cash is, you pay, depending on your age, $50, $75, or $100 a month. You get that every single month, right? And then if you call up, you need something, you have a cold or whatever, you come in, you have something wrong with your foot, you stepped on a nail. That's all good to go. You go in there, you guys handle it, and there's no paperwork. But the main thing is, and you bill out. If I need a blood test, I go for my annual checkup, right? I'm 61, you need to take my blood, etc., right? But it sounds like, Dr. Rutherford, what you're saying is, having made this transition, the actual cost savings to the patient, forget the insurance, the cost savings to the patient is 30, 40, 50% on stuff.
At least.
At least.
I have Medicare patients who come to see me who basically make money because they come in, a lot of people over the age of 65 have been placed on all these medicines. They've been on, 10 medicines for 5 years. Their doctors they are seeing in the system don't have time to really sit down with them and consider whether or not they even need all these medicines. And even if they have a Part D plan, they may be paying $200 for these medicines.
Right.
So, and they come to me, and because I left this out before, but I actually, in Kentucky, we're allowed to dispense. Physicians can dispense from our office. So I dispense medicines. So the savings on those is 95%. So
just the actual prescription drugs.
Yes. So we have a pill counter and we have the bottles.
So in Kentucky,
I order
you can
them.
actually you're so basically what you're doing, Dr. Molly Rutherford, is you are cutting out all middlemen everywhere. You're cutting out the pharmacy, you're cutting out the bureaucracy, you're cutting out the coding people, you're cutting out the insurance companies, you're cutting out the government bureaucrats, you're cutting it all out. And when you cut everything out and you go to get a medication dispensed, you're saving 90 or 95% for the patient.
Exactly.
It's incredible.
Yes. Yeah,
that's the model.
My mother-in-law, for example, she has Medicare, and she needed 3 medicines recently, and I didn't have them in stock. So I said, well, I'll send them over to Kroger for you, but please let me know if they're more than $10 because I can order them and have them by tomorrow. And she, it was going to be $48 or something at Kroger, and I can dispense the same 3 medicines for about $4. So
that's like a 95% savings.
Yes, it is, and that's true with imaging as well. I had a patient who had pretty good insurance, and she needed an ultrasound.
Look, Dr. Rutherford, I know there's more of Dr. Rutherfords out there, but we need to put you on national TV because what has been bamboozled here? Everybody is bamboozled by Medicaid for all and high cost of insurance, and it's all the bureaucratic nonsense that's right in the middle of it. So it's a self-fulfilling prophecy driving the cost, and everybody's making money
Right.
except the patients. And
Yes.
and then of course the doctors, like you say, my doctor takes Medicaid, Medicare, all that stuff, and he's a great doctor, and I'm not going to leave him. I pay cash, but he has the revolving door where you got four patients simultaneously. You get 10 minutes each. I mean, he's got to do that to me. He's got a big over. He's got 8 people in there, billing, receptionists, whatever. So it's a constant revolving door of people in order for them to make the profit they need to make a decent business, right?
And
Crazy.
right, and nobody's happy. The physicians aren't
Nobody's happy.
The patients aren't happy. Nobody is satisfied with what they're doing
All
because
right, I got to roll,
Yep.
Dr. Rutherford. I am out of time. Best interview on this topic ever. Thank you. I want everybody
Thank
to
you
go
so
to.
much.
Yeah, you're the best. Go to healthcareforyou.com. Healthcareforyou.com. Job Creators Network and Elaine Parker. They have this figured out, guys. They have it figured out for the country, and we need to put Dr. Rutherford on like national TV because you can save 95%. It's all the bureaucratic crap that's in the middle of it.